So give us a bit of a clue on why you ended up in dental school.
I didn't get into dental school the first time. It took me kind of 4 years to get started at AT still. But it kind of opened up my eyes a little bit more to like what I wanted to do because through those 4 years and even beyond, I think public health has always been something I've been very drawn to and interested in. And like I talked about, like I love the arts and I love the sciences, and dentistry kind of gave me that conjunction of both. Then I went on my first mission trip in Ohio State for dentistry, and that kind of opened up my eyes on a lot of the public health needs. And so for me, that's why I was so drawn to AT Still and kind of moving in that direction of dentistry and just dental school in particular, because public health is like the core value for the school. I just came back from Oklahoma, was in Cherokee Nation, and I just remember people coming in from like 3 to 4 hours just to get dental treatment because obviously if you're a part of the Cherokee Nation, you get free dental care, but sometimes people come from far and why just to get any kind of care. Advocating is really big in public health. You got to advocate for policy change, you got to advocate for your patients and resources. And sometimes it's even advocating for students itself. And so like for me, I've gotten to do a little bit of both on a lot of I've been to National Lobby Day, I've been to Lobby Day for my state, so Arizona, and even just as the president of the American Student Dental Association, I have been able to see how advocacy is driven in different states and at different schools.
So, of course, what leads me next to the question of why American Student Dental Association?
I think those mentors I made when I was a D1 who were D3s or D4s, they definitely kind of broadened my horizon a little bit. And I think they definitely advocated for me in that sense of just being like, hey, there's this organization and I think you'd make a really good, like, a leader or a member or some aspect of this organization. And it's because of them that I got so involved in ASDA or the American Student Dental Association.
If I'm a dental student, and I want to get involved in serving communities or broader, I want to follow in your footsteps and I want to advance public health. How do I get involved in public health?
I think mentorship, like I said, is probably the key because without my mentors, I don't think I would be where I am. They helped guide me into like the direction that I see myself being. And so reaching out, your local dental association might have, if not, probably have multiple people who are within the public health sector, kind of reaching out to them, getting their mentorship, but also just seeing like at community service events throughout the community. There are so many opportunities sometimes to kind of help our community, and you don't realize that they're a part of that sector. So I feel like definitely going online, researching some things about it, but also finding a mentor and kind of getting more involved in the community. I think that will kind of drive you into realizing there are so many other avenues and so many other pathways to get involved and kind of see yourself in that light or in that future.
That I understand ASDA recently founded a wellness council.
Yes.
Why is wellness important?
I feel like it's one thing that sometimes we talk about wellness, but we never perform wellness. And I feel like as students, we're so driven to being like, we have to be perfect all the time, or we're burning out from all of the studying that we're doing or the clinical, that sometimes we forget that our well-being is so important. And so I feel like with this new wellness committee, we can do so much that may not be done right now in particular. Because right now, wellness is just something that we are assuming that a lot of our classmates or our peers are doing. But maybe with this, we can have some formalized more events or resources or benefits. If you're not well yourself, then how are you able to give your 100% to a patient or your peer or to yourself in the sense of, delivering that work? So I definitely think it's very important to have.
Well, in another context, there is a direct correlation between
Yes.
good oral care and good health. This is an area we need students to be advocating because right now, dentistry is a bit in a silo. There are many that view this as a drill and fill operation, and it needs to be part of functional medicine and the complete body. So I hope this is something you will advocate because your enthusiasm definitely it will be listened to. Excellent. Your passion is infectious, even though we're doing this by video.
Yes.
I commend you for what you're doing. Thank you for your time. good luck. We're very supportive of ASDA. We have been for years.
Yes.
And if we are needed, reach out to us. We'll get a
No, of
response.
course. No, I appreciate it. Thank you so much, Stan, for taking your time, for kind of just meeting with me and learning about you and all that you kind of stand for has been such an amazing kind of experience because I feel like me and you, we have similar values and similar kind of alignments in what we want to do. And so it's been great talking to you and just getting to know you as well. So thank you.
I enjoyed our discussion.